Good evening and welcome to the meeting of our Safety and Health Committee. This is February 24th and we're at about 10 minutes after 7. My name is John Twilliger. I'm the chair. To my left is Mr. Roselle and to my right is Mr. Schilling. This evening we have before us a piece of legislation dealing with the One Ohio Memorandum. Mr. Titterington, if you could share with us.
Sure, thank you, Mr. Chair. What we are asking for is a resolution of support for the memorandum that you have in front of you. This is not a commitment, this is not a final signature, this is not an acceptance of any kind of settlement. It's not agreeing to any kind of dollar figure. It's way, way too early. What this involves is the opioid lawsuit, of which there are 50 across the United States at least, plus major cities have also weighed in on their own, including several in Ohio. In our case, on advice of the law director early on, we opted to be part of a class action effort and have been moving forward with the state consortium of 2,080 some communities, which includes city, county, villages, and townships, in trying to move forward with a comprehensive strategy and structure and framework under which our attorneys can approach the big pharma, which they've already been discussing, as to how to settle this equitably and quickly, because nobody else in the United States has come up with a comprehensive plan like Ohio, so we could be and would be first out of the box, out of the gate, excuse me, and we would have a structure in place that would allow us to negotiate a healthy settlement that would guarantee that the lion's share of the proceeds would be out of the state of Ohio's legislature's hands, which was always a big concern and has been a big concern, because the last effort that we did many years ago was involved the tobacco settlement. Nobody received very much money out of the tobacco settlement except for the state of Ohio. And so that was a big concern, and it was a big concern for the governor and the attorney general that history not repeat itself. And so that's why this framework was formed. That's why this memorandum has been proposed. They are asking for action by as many communities that support it by March 6th, because there are 50 plus efforts underway nationwide. We are the first one. We are the most organized. We have the chance to get in basically before many of these pharma go bankrupt, because there are billions, and in one case even $1 trillion being asked for by one of the states, realistically or not. And so getting out of the gate quickly is we believe, key to being successful. Without getting into the details of the structure of the plan, Troy would see funding from this settlement. It's based on a three-part calculation that takes into account opioid deaths and compared to some of our neighbors, we have fared better. And then there are a couple of other criteria involving demographics and particularly population that come into play. Because we don't have an amount, we can't say, we don't know what that settlement would be. But by passing this, then we are guaranteeing that we will be part of the settlement.
Question.
Okay. Mr. Schilling.
Troy is not involved right now with any litigation concerning the opioid crisis right now,
Not separately, no, we did not.
and
file
we're not
that.
considering anything that we should be aware of, other than this.
No, and Mr. Kerber and I discussed it. We talked about what our options, one of which would be filing our own, and because of the power of so many communities going together, we felt that it would be much more cost-effective and expeditious for us to join in a class action than to do it on our own.
Okay. And this is another question. When we do an EMS run, do we bill somebody for that? Do we have the ability to bill the insurance company or send the bill to the private individual, or what?
We do when there is a transport involved.
Right.
We're not allowed to bill for sending an ambulance. It's if we take them to the hospital or to a treatment facility, whatever, that we then will bill
Okay.
the insurance.
Mr. Rozelle? Anyone else would have something you'd like to say? Okay, forward. Does this need, there's a date on this one, isn't there?
March 6th.
We need this by emergency.
So we need emergency.
Yes.
It'll be on Mondays.
And what would you like to do? Move forward?
Move forward
with
with the emergency, yes.
Move forward with
Yes.
emergency? So that's what we would be doing.
All right, thank you.
Anything else to come before health and safety?